You know, I have to tell you, sometimes, hello, America, sometimes I should listen to my own advice. I've told you over and over again, watch the other hand. Watch the other hand. These people are like David Copperfield. Stay with me this hour, will you? In just a few minutes, I'm going to expose two things that this White House does to totally control the debate. And I'm not just talking about the Democrats, I'm talking about the Republicans as well. If they had any kind of argument, we would not have this. This is the international debt clock. No logic ever gets you here. No country gets to a U.S. national debt of this. No country, using logic, has a liability of $343,724 per citizen. How did you get there? That's selling our children's future out. It's indefensible. So what is their real agenda? Their real agenda is control. Everything that I wrote up on the board just in the last couple of days, every single thing is about control. They want to control everything. But the trick is about to fail. And I think you're beginning to sense that. Yet, I was thinking today, they still have one more trick up their sleeve. One more. Question is, will it work? Well, not if you know what it is in advance. The administration seemingly is wasting a lot of time and energy attacking Fox News.
The way to look at it and the way the president looks at it and we look at it is, it's not a news organization so much as it has a perspective.
They're not really a news station. If you watch even, it's not just their commentators, but a lot of their news programming, it's really not news. It's pushing a point of view.
I was so flattered when I thought, they like me. They really like me. And everybody here at Fox News. They sent the big boys out. Wow. And then after I got over myself, I went, wait a minute. Why would you do that? That doesn't make any sense. I mean, if you think of it strategically, you don't pick a fight with Fox News. You don't pick a fight with anybody in the news business. That's a losing battle every single time. There's an old saying, you don't get into a war with people who buy ink by the barrel. It's an old saying. Don't get into a war with newspapers. Now you can get into a war with newspapers because nobody's reading them. And I don't think they just usually buy the ink by the cup now. But Fox doesn't even buy ink. It's unlimited airtime. Why would you do that? Why would the administration do that? Let me ask you this question. Wouldn't you say that the most important agenda item for Barack Obama has been health care reform, right? It's been his top priority for 3 years, 2 years during the campaign. He has laid every card down on the table. He has promised the left that he would deliver health care reform. He has repeated that vow over and over and over again. He keeps saying this is the closest in history we've ever come. They've wanted this for 100 years. Finally realizing the dream of socialized medicine in America, like we've all been pining for a Cuban health care system. He has guaranteed victory by the end of the year. Hear me, guaranteed victory by the end of the year. He has reiterated that stance just this week. Well, I mean, hang on just a second. He can't lose this battle, right? It's his legacy. John Boehner said it's his Waterloo if he does. Why would he be marshaling forces against us? You know, I've told you a million times, the guy is David Copperfield. And you just keep falling for it over and over again. The guy is, can you pull in tight here? The guy is a magician. He wants you, you know what? We need a little magic lighting here. Just a little, yeah, spotlight, magic lighting. Okay. The guy is absolutely a magician, okay? He wants you to watch. Just keep watching. Look at this. Just do this. Guy's a magician. Putting the spotlight on me. Watch that. What happened? What happened? Ooh. It's magic. It's right here. Okay. So what's the big deal? Well, it's not even really about this. It's about putting the spotlight right on me, right on Fox, on anything. Put the spotlight here. They knew by waging this war on Fox, we'd get stronger. I mean, our ratings are up. This is good for us. Why would they make us stronger? They don't seem to care about that. Maybe, did you notice when I did this? Come in again. Did you notice when I did this? I did this. You point with this hand. Look over here. Look over here. The hand that is holding the gold points to the other hand. They need to distract us long enough. Use that misdirection. Because see, once they pull up and you turn on the lights and you're like, wow, that was amazing with that coin. You see, what has changed here? What has, oh my God. Oh, yeah. Healthcare has magically appeared. All while you were watching the stupid little coin. You know what? They believe if they can get you to watch the coin, if they can get you to have you watch me and Fox, well then they can slip this by and get it passed. Remember, America, while the White House is busy waging war on Fox, what this is really all about is the effort to push health care. I want to show you what we're headed for with universal health care. Don't forget the you know, we don't have to look across the pond or in Canada. There is an example that is much closer to home. Yes, it's in Barney Frank's home state. Universal health care. How's that Romney care working out for him? Since 2006, the state's overall cost, remember, the overall cost is supposed to go down. There in Massachusetts, programs have skyrocketed 42%. It's out of control. It's eating up the state budget. Democrats are now scrambling to compensate. How? Taxes. They've increased fines also for those who didn't get insurance under the individual mandate. They've increased business penalties. They've taxed insurers and hospitals. They've raised premiums. They've even in Massachusetts, this isn't, you know, Botswana, Massachusetts, they have resorted to group doctor visits. You're like, okay, he's got a gallstone and I got a sore throat. Can you do this at the same time? It's still not enough. So what are they considering? Excluding coverage of low priority, low value services. Also, limit the coverage. Implementing spending caps. Wait a minute here. This sounds like everything that they're denying would happen in the universal plan. So less service, less innovation. Oh, and guess who decides what the value is? No, not the doctors, not you. Those in the State House.